Refugees fleeing fighting in Sudan arrive in Jeddah, a transit point between Sudan and South Sudan. 12-year-old Bahita Al-Mahad endured the grueling multi-day journey on foot shortly after being diagnosed with breast cancer. Bahita is feeling sick today, and her mother, Naima Abdallah, speaks for her.
It started with some rashes and chest pain. Then it developed into something hard, like a stone. Her skin started to fall off, and it was getting worse and worse from there. That is when we realized that it was something serious.
According to aid group Save the Children, more than 600,000 Sudanese refugees and South Sudanese returnees have crossed into South Sudan since last April. The region is already facing a severe hunger crisis and an overburdened healthcare system. For the new arrivals, this border town proved less than they hoped for. Upper Nile State Minister of Information, Lucas Sadala, says deaths in the camp are on the rise.
I have recorded 194. From 194, only one women and one man.
The country's health sector got a shock earlier 2023 when international donors cut their contributions. Yolanda Awel-Deng, South Sudan's Minister of Health, says her team is struggling to fill the gap with its small share of the country's total budget.
As you know very well, the budget of the Ministry of Health is barely 2%, is 1.8%. And even that 1.8%, we don't get it. So, and when we get it and we try to push, the amount of commodities and also the personnel we take there is not enough.
Aiwel, the medical director at Renk Civil Hospital in Upper Nile State, explained local medical facilities are not equipped to handle chronic diseases.
Patients with cancers like breast cancers, cervical cancer, and a different form of cancers, and others they were on chemotherapy, and when they came here, as we are a county hospital, and there are some cases we cannot be handling them.
Bahita Al-Mahad's mother says her daughter survives on one meal a day and her condition has worsened since arriving in Jeddah. Some families say they will stay in South Sudan, while others such as Bahita hope the war back home will end soon so they can return to Sudan and get the specialized treatment they need. Sheila Ponnie, VOA News, Renk, South Sudan.